Hi there. This is Dr. John Whitcomb talking about benign incidentalomas in women are common and they cause trouble. What's an incidentaloma? It's an incidental finding looking at the adrenal glands that sit on top of your kidneys that looks like a swelling or a lump. Now, Cushing's disease is a discrete tumor usually on the adrenal glands that puts out too much ACTH that basically puts out too much cortisol autonomously, and it makes you have Cushing's disease, which is high blood pressure, diabetes, weight gain, buffalo hump, stretch marks, central obesity, high blood pressure, blah blah. Everybody knows about Cushing's disease. The question is there a continuum of pathology between these benign incidentalomas, which seem to be swellings or lumps but haven't turned into a discrete tumor yet? And is there a correlation with that and MAX, which is mild autonomous cortisol secretion, MAX, M-A-C-S? So the study in England looked at this, and son of a gun, there's a huge correlation. Such a correlation that, in fact, it would account for some 1.3 million English women, postmenopausal, who suddenly get high blood pressure and diabetes and central obesity and can't lose weight, and they've got weight around the middle. That's a huge finding. Extrapolated to America, that would be some 8 million women. Something on the order of between 5 and 10%. That's not a small number. And there's a surprising number of women who say, I can't lose weight. I don't know where my blood pressure came from. I never had high blood pressure before. Could I have Cushing's disease? And our traditional approach has been to downplay that because we haven't had a diagnosis or name or guidelines that fit around the concept. I have personally seen a number of people who describe themselves as that, and my ears burn with embarrassment to think that I participated in blowing them off. This is now a real diagnosis. The stage is set. This is quite a big shift. We need to be empathetic to that, but we also need guidelines and numbers to put around it. Should we be getting more CT scans looking for it intentionally? What's the 24-hour urine? How much cortisol do you have to be secreting on the 24-hour urine? Do these folks actually get suppressed by Decadron, the standard approach? There's a lot that needs to be learned, but the door has been opened. God bless those curious Englishmen who sorted this out. Benign incidentalomas. They're common. They cause trouble. And the question is how to fix them. Do they need to have surgery on their adrenal glands? All that may happen. Dr. John Whitcomb, News and Nutrition. Hope that isn't your story, but there may be hope if it is.